Dear students, I am Dr. Mahesh Hirulal, Assistant Professor, Department of Roganidana. In this video, we are going to discuss about ICD and DSM classification. ICD means International Classification of Disease. This is done by WHO, World Health Organization. Still now we are using ICD 10, but since 2020 there was a new release of ICD 11. WHO regularly segregates and classify the morbid entities. The purpose of ICD is to permit systemic recording, analysis, interpretation and comparison of mortality and morbidity data collected from different countries or areas at different time. If you see that, what will happen, there are new emerging diseases will be there, or the old diseases will be there. The data will be collected by the WHO. They will record it and they will analyze and interpret what is the morbidity and what is the mortality and what is the incidence of the disease, etc. from all over the countries, all over the different countries, and even in the countries at the different areas. And after collecting, the ICD translates diagnosis of diseases and other health problems from word to alphanumeric code. So this is the importance in ICD classification. As a medical practitioners, we will read any illnesses with the disease name, but in ICD they will be represented with alphanumeric code. Alphanumeric means one alphabet will be there and another one is the number. With this, they will be giving a code for each disease so that it will be easy for storage, retrieval and analysis of the data. If you browse the WHO site, this is the ICD 11 for morbidity and mortality statistics. This is the ICD 11 classification, where we will see different classifications like certain infectious diseases or the parasitic diseases, neoplasms, hematological disorders, immune disorders, then metabolic disorders, behavioral disorders or the psychiatric disorders, then nervous disorders, visual disorders, etc., circulatory disorder, respiratory, digestive, etc. disorders, and they will classify in a hierarchy and they will code it. What is the purpose and the use? ICD is a foundation for identification of health trends and statistics globally, and the international standards for reporting diseases and health conditions. Take for example of the COVID-19. It is a present trend in the medical world. The WHO has given, when the COVID-19 has came in the China, it was still, the name was not given, but after that they gave the COVID-19 as a name. Okay, COVID is alpha and the 19 is the numeric, and for that they had given some code. Okay, so that is a trend and they will collect all the statistics internationally, and it is a diagnostic classification standard for all clinical and research purpose. For any clinical purpose and for the research purpose, we need this ICD classification. ICD defines the universe of the disease, disorders, injuries or any health related conditions in a alphanumeric code, which will help for easy storage, retrieval and the analysis. See, The disease names are very big and enormous. For easy storage in this digital world, we need the alphanumeric codes, and for retrieval also we need the alphanumeric code, and for the analysis, the statistical analysis, we need this ICD classification. And it will also help for the sharing the information and the comparing the information. What is the statistics in India, we can share it into the US, or what is the statistics in Karnataka, we can share it to the central medical teams. Okay, so different regions and the hospitals can share, compare and make the research in a different disease trends with the help of ICD. See, users including monitoring the incidence and the prevalence of the diseases, observing reimbursement and resource allocation trends, and keep track of the safety and quality guidelines. It will observe what is the trend in the disease and how much reimbursement. So in insurance area, health insurance area, there will be a reimbursement for the clients. So in Western world, it is a most common thing. Okay, every person will be having the health insurance and they has to reimburse. And according to this, ICD will also help for the reimbursement and for the health insurances, and also make the resource allocation trends. Okay, for the polio, okay, we have to allocate some money, or for COVID-19, we have to allocate some money. So according to the trend, how much money has to be allocated, etc., can be done from this with the help of this ICD classification. In ICD classification, there are two major parts. Rather than classification, it is the major parts in classification. That is, first one is data related to diagnosis and health status in a tabular list. It can be condensed and expanded according to the specialty. The second part of ICD is the other aspect of the health problems, medical and surgical procedures, reasons for contact to the healthcare providers. So these are two parts. Okay. How this ICD will run is, ICD will be having core classification,